Hey, what's going on, everybody? Welcome today. Back. I see the chat is starting to get hit up. Open mic at Monet. Yes, yeah, my mic was open. It's cool. It's cool. How's everybody doing out there? So we are waiting for President Trump to come in and talk about what's going on. So for those of you who've been living under a rock, obviously, we are in coronavirus madness right now. There's a global pandemic. And unfortunately, it seems like the the numbers here in the United States have just exploded. I think what's one of the largest increases of coronavirus cases in one day by any country. New York City now, or New York State, has 5% of the worldwide positive cases, and that number seems to be growing. From what it seems like, things are not going as well as they thought. So since the president is doing his little thing, let me show you guys the numbers that everybody are concerned about. Okay, so here is what is causing the panic. Here we go. Sharing the screen. All right, so you guys should be able to see this now. These are coronavirus cases, and the U.S. number, let's go to countries. The U.S. number has just exploded. This is now the New York number. So we're trying to figure out what the hell is going on. Let me blow this up so people can see this. Today we've gotten 8,000 new cases. Remember, everybody's concerned about Italy only having 6,000. And out of those 8,000 cases, for those of you who don't know already, they do it by state. 5,000 of those new cases are in New York, making New York 15,000 cases. The next closest is New Jersey. So it is panic mode because you have to stop the spread of this virus. So they are trying to figure out now what is going on. Let me go back to StreamYard so I can see anything going on in the chat. So New York the numbers in New York have just blew up. So that's what we got. So today, that's why you have the press conference today, because the New York numbers and the US numbers have just gone off the charts. So we're going to see what the government's response is going to be. Let me see who's in the chat. Yeah. Why there's so few recovered cases, I do not know. But I'm thinking it takes 14 days from the cover. So 14 days ago, it's March 7th. So I'm thinking, people are still maybe recovering from cases. This is, I don't know. It's coronavirus thing is real insane. Let me go to the chat to see what you guys are talking about in the chat. But yeah. If you guys are gonna get any questions for me, let me know. I gotta close some of these tabs. All these tabs open. All right, let's see what's going on in the chat. Anybody? Let's see. All right, so few recovered cases. Yeah, right enough. Recovery is defined. No propaganda, please. I'm trying not to give any propaganda. There will be no propaganda. But since we're waiting on La President, and he seems to be late, they're supposed to be starting this press conference at 5 o'clock, so I'm just going to react to it and just look at it. But they seem to be running late. But yeah, so we are at 5,000 new cases, and the numbers are looking grim. $2 super chat from Joe Med. I actually started to get a little worried. I'm starting to get a little worried now. Just now. So until the president comes, let me show you guys what I've been working on. So I've been working on a video for coronavirus, the coronavirus video. And just something like kind of what's been going on out there and just giving people my take on it. So I'll preview it to you guys now so you guys can see it. But if you guys are, if this thing is scaring you and you got like, if you're like, coronavirus, don't watch this, because the numbers that I'm going to show you are going to scare the shit out of you. So if you just can't take it and just like, I just don't want to see the truth, don't watch this. Like, stop it now, because in like a minute from now, and unless the president comes on the screen, we're going to go over some of the hard facts and why people are freaking out. So just, I'm going to do a produced video, but you are going to see what's going on. I like this. The purge, the great purge has begun. Evolution, baby. Evolution. It's funny because I had someone tell me, anti-evolutionists was saying, well, this is what evolution predicts, right? Those who are suited for the environment. So I'm like, oh my God, this is, it's crazy, but it is what it is. So let me share what I've been working on with you guys, so you guys can see my process. 1 second. Share screen. Okay. Let's go Chrome tab. And pardon all my misspellings, but this is like my process here. All right. I don't know if you guys can, let me see if you guys can see my screen. Yeah, you guys can see my screen. Let me blow this up while we wait for President Trump. So this is my PowerPoint. Well, actually not PowerPoint. This is the Google thing, the Google Slides thing. Let me just do view. Present this. All right, yeah. So this is my Google slide. Now this is just about the coronavirus. Now, for those of you who are new here, if anybody just got here, we're waiting for President Trump and his people to come in to talk about the bomb that went off today, which is the U.S. number. The U.S. number has just skyrocketed to 8,000. So this is my my upcoming video, and this is just, and what I'm trying to do is go over what this video was supposed to do. It was going to go over what is happening, like what is happening with the coronavirus, why it's such a problem, and what everybody's freaking out about. So it starts off where the CDC and the scientists are predicting that this thing is going to have an infection rate between 48 and 65%. They've now adjusted that up a little bit to about 80%, but this is what. So when doing this, I like to take the conservative number, 48%. So we're going to be working with the most conservative numbers. Again, because I think it's just safer to work with most conservative numbers. So these numbers come from the New York Times, the CDC. I'm getting these numbers from the source. So they expect out of 331 million Americans, 48% of them, which is 160 million, will become infected with the coronavirus. So $10 from Learning from Suge. I appreciate the stream, Nate. Stay safe out there. Hey, I'm in New York and my wife's a doctor, so we deal with this like every day. Thank you, Suge. I really appreciate it. Let me put that up on the screen. This is Learning from Suge. Thank you, Suge. So this is the reality of how many people the CDC, again, conservatively believes are going to get the coronavirus. So this is where we're at. So out of that 160 million people who they expect are going to be affected, that's really, they expect it can be anywhere from 5 out of 10 people or 7 out of 10 people will be infected. That's a lot of the population. Now, a lot of you maybe not understand this, but the issue here is what they call the hospitalization rate. Even though 160 million people get sick, if you get sick with like the common cold, you're not going to the hospital, you'll say, so what? You know what I'm saying? I'm sick, but I'm not, I don't need to go to a hospital. So, you recover from it. So really, we're talking about the hospitalization rate. How many people who get sick are going to need to go to hospital beds? That's what we are talking about. So when you look at the hospitalization rate, that's the 160 million people we're talking about. These are people who get sick, need to go to and be in a hospital bed, need to stay in a hospital for a certain amount of time to recover. That's what we're talking about. Now, this number, the number that we're going to get for that percentage, It's from the Journal of the American Medical Association. Again, the New York Times article with the estimates, and the CDC. And also we're going to be using New York State's estimates too, which they estimate about the same thing. The hospitalization rate is 15%. What does that mean? Well, that means out of that 160 million people, 15% of them will need to go to a hospital bed to recover, right? They'll need a hospital bed. That number, if you just simple math, 160 million multiplied by 15, 24 million people in the United States are going to need hospital beds to recover from the coronavirus. That's what we're talking about. That is what we're talking about. We're not talking about, we know a whole bunch of people are going to get it, but 24 million people are expected, based on the data, are going to need hospital beds to recover or die. That's where we're at. So the first thing you would say is, well, if these people need hospital beds to recover, 24 million people, how long do they need? Well, on average, not on average, they suspect it's 14 days. The hospitalization rate where someone with coronavirus goes in, they'll be in a hospital for about 14 days, a 14-day stay. Now, the average is really 10, but they're usually 14 days because I'm doing a very conservative estimate. 14 days, but it could be possibly, the average is actually 10. So this brings us to the healthcare system and the capacity of the healthcare system. Now, this is what's freaking everyone out. The capacity in the U.S. healthcare system. To even get to that number, let's look at the North Korea, can't look at North Korean numbers, the South Korean numbers. South Korea has a population of 5.1 million, and they have 600,000 hospital beds, 600,333, right? That averages out, if you just do the simple math, divide 12.3 hospital beds per 1,000 citizens, and that's what you get. This is what you get. Does anybody have any questions in the chat? But that's what you get. You get 12.3 per 100,000 citizens. Pretty simple number, right? This is nothing shocking to everybody. But what is the U.S. number? Well, U.S. has 331 million citizens and 925,000 hospital beds. And that number comes from the American Hospital Association, New York Times, CDC, all those report that number. That's 2.8 hospital beds per 1,000 people. If you compare that to the Korea number, to South Korea, this is what you get. 12 hospital beds per 1,000 citizens to the U.S. 2.8. This is a problem. This is a major, major problem, right? And to be honest with you, it's not just any hospital bed. You actually need specialized beds, but we're not even talking about that. We're talking about the beds, just hospital beds. South Korea has 12.3 per thousand. We have 2.8. That's a 4-time difference. They have 4 times more beds than we do. 4 times more beds. And if you look at the rest of the countries, like Italy's going through that bomb. We have less than Italy. We have less than China. We have less than France, Germany, South Korea. Yes, we have a problem. We have a problem. All right, we're talking. So now, 24 million hospital beds that are going to be needed. 925,000 hospital beds that we have. Now, don't forget, we still got people having car accidents. We're still going to have people having heart attacks. And we're still going to have people that any ailment that you talk about, diabetes, hypertension, whatever, they're going to need a hospital bed to recover. If they don't have a hospital bed, some of these people will die. It's modern medicine. Think about it. Every year, you have about 36 million Americans who go to the hospital for hospital stays. And those stays are about 5 days. If you add 24 million new people to that total, it should take about 2 years. If you just have one, it'll take about 2 years to service all these people. They're expecting this to happen within the next 6 to 9 months. So you're talking about taking a year's worth of people who need hospital stays and trying to run them through a system in half the time. It's just plus the people who already need the hospital beds. And those people from coronavirus are probably going to be there for at least 2 weeks. This is what the problem is. It is the capacity of the healthcare system. This is the problem. So if you take a simple graph, number of cases, capacity of the healthcare system, you've guys seen this graph before. If you spread out all 24 million people over a long enough time, the healthcare system can easily handle it. But this is what we have. We have this. This is what's going on. And this graph is really about exponential growth. If you have no prevention, right? The infection rate from person to person is insane. And this is the case of New York State when you had the one doctor who infected 50 people. Now, mind you, and I think this is something that has to be said. People have to understand that they found out that the virus can be left on hard surfaces up to 3 days. So if you're on a train, I wipe my mouth and I grab a handle to stable myself, and I'm infected, that's going to stay on that hard surface for possibly 3 days unless it's cleaned. Door handles, elevator buttons, 3 days on hard surfaces. I think they said on soft surfaces like cardboard, it's 24 hours. So 3 days. 3 days on hard surfaces. So this is what is happening to the healthcare system right now. And this is why people are scared, because if one person can infect 50 people, so this is one person infecting 50 people, those little things down there are 50. In 2 weeks, you can have 2,500 people from one contact, from this one guy. That's insane. And then look at our mass transit system. Just imagine if one of these people in this goddamn thing was infected. How many people would they infect? Mind you, anything they touch is now could pass the infection for 72 hours. But in that's close quarters right there. That's the subway system. That's the system that the lawyer who was infected 50. That's the system that he was on. That's what he was taking. He was taking the train. This is where he was at. How many people did he actually infect? Think about it. Looking at the chat. Now, Trump is late. Trump is like 20 minutes late. What's going on with this guy? The bomb is going off. That's the problem. I don't think they know what to do. So look at this part of the curve that I've highlighted. This curve. That exponential growth. That's exponential growth. That's where you're doubling and tripling cases every day. That's what we're going through now, exponential growth. And that's what this graph is trying to explain. You don't want exponential growth because it's going to give you a lot of cases too soon, overwhelming your system. Now, the CDC has estimated that we could lose, and again, this is in a year's time, so we're talking about 6 months to a year, from 200,000 people to 1.7 million deaths within the next couple of months, 6 months to a year. So this is, the nightmare scenario. 1.7 million is the nightmare scenario. And just imagine losing that many people in such a short time. That's World War II numbers right there. It's World War II numbers. So let's talk about prevention. To stop one person from transmitting to 50 people to 250 people, to stop this exponential growth, because you want to stop new infections. You want to stop new infections. That's the only way. If you're not infected, then you won't need the hospital. And, you want to stop new infections. So one person gave it to 50 people, 6.25 million, 6,250,000 people within the next in 3 phases, 1, 2, 3. But new infections, there's only 2 ways that you can bring them down. Limit exposure. That's why they're telling you to stay in your house. That's why they're telling you don't visit people. That's why they're telling you no gas. They want you limit exposure. If I don't get in contact with somebody that's exposed, if I'm not riding the train or commuting to work, possibly touching a car, door handle, or money, or something that's been exposed, my exposure risk is extremely low, and we can lower new infections across the board. If they locked everybody in a room for a year, then obviously they would stop the spread of infection. Hard to do, but that's what they're doing now. Closing schools. This is what's happening now. Let me go to the chat to see if there's any questions. Am I just talking to the void here? Are people getting this? Uh-oh. Fiona, I see they didn't do your research. Uh-oh. It's hot in the chat. Well, so now the second way you can stop new infections or lower the amount of new infections, because that's what you're seeing. That's what all the fuss is about. New infections. Limit the amount of new infections. You can somehow prevent transmission after exposure. So let's say you do shake someone's hand who happens to be infected, or let's say you do touch a door handle that happens to have the infectious agent on it. They tell you to wash your hands. That's a way that they tell you to limit transmission after infection. Don't touch your face. They give you all these guidelines of what to do so you don't get infected. So these are the two ways that you can bring down the amount of new infections. Don't have starve the virus. And that's what I think exposure is more like starve the virus of victims. No, it can't catch anybody else. And the other one is transmission. Well, even if you do, you take precautions, you wear a mask, you wear gloves, you wash your hands, those type of things. So these are the way you want to limit the virus, especially since we have no real tools to fight it or stop infection. So for exposure, they've been telling us, limit gatherings, social distancing, keep people home, right? Stay at home. That's in California. Stay home and no contact with others. Don't go visit grandma. You stay your behind home. If you want to limit transmission after exposure, you wash your hands, you get hand sanitizers, no touching your face, no putting masks on. Again, transmission after exposure. Let's see if the president is coming out. No, all the reporters are there, so I'm thinking they're going to be coming out any second now. But yeah, so this is what I've been working on, and I'm gonna finish putting it together. But it's there's just so much information out there, but you want to make sure people understand what's going on. Now, where did I want to go? This is the healthcare system chart, but when you do a deep dive into this, it's really about look at this curve, this exponential growth. It's crazy. But when you look at this, it's like even this graph. When I was looking, I was like, well, what would be more analogous to this graph if the capacity of the healthcare system versus this, could I make it to scale? And I tried it, and making it to scale is the one of the lowest I can get it. So you can see that there's actually two lines there, but it's actually lower than this. This is to scale from what they expect. That's insane. The capacity of our healthcare system is almost not. We're talking about a lot of prevention. It's crazy. So, I want to see what he has to say today, but it's, this is insane. Like, even look at this. Let's take New York State as an example. New York State, remember when I told you United States is 24 million people that are going to be infected? Well, you do the numbers for New York State, it comes up to 1.4 million people. New York, the United States as a whole have 925,000 hospital beds. New York State has only 56,000. So they're in a very similar situation. Check this out. So if you run out the 56,000 beds that New York has versus the 14 million people, you get a multiplier, 25.2. You'd have to put those people in hospital beds 25.2 times to get them through the system. Now, you can do that in a month. You put 56,000 people go on day one, they come out. 56,000 people come in day two, they come out. And if you do that, here are the numbers. It comes out to about 1.4 million. So you can do it in 1 month. You can run 56,000 people, but don't forget that's only coronavirus patients. That's no car accidents, no anything else. This is only dealing with patients for coronavirus. All other surgeries, cancer treatments, all that other stuff stops. This is all you do. handle patients with corona. That's what this chart shows. And you must do that for 25 days if you want to get rid of the 1.4 million people based on our capacity, which is unrealistic. And that is the best case scenario where if you can do 1 day's worth of treatment. See, if you want to do 2 days worth of treatment, somebody needs 2 days worth of treatment. Now you have to do it. You have 2 sets of 25, right? That person's going to keep that bed for 25 days. Then they come out, another person takes that bed for 25 days. So you just doubled the amount of time needed. But for the coronavirus, it's 14 days. We're talking about 14 days of those sets. That's, again, unrealistic because this is 14 days of only dealing with patients who have the coronavirus. Nothing else. Someone breaks an arm, someone gets in a car accident, someone has a heart attack. They can't go to the hospital. This is only dealing with corona for 14 months at full capacity. But the CDC and all the World Health Organizations, they believe this is more likely. 18 to 24 months, and more likely to 24 months, that you can deal with this problem. But you don't get here to the 18 to 24 months unless you stop new infections. This does not happen unless you stop new infections. That's what you get. That's the problem. You must stop this to get new infections. You got to stop to get a chance to have this happen. You got to stop new infections. Let me go to the chat because I am sitting here preaching like it's Sunday. It is Sunday, right? It's church. So can use common sense. Now, understand what running a healthcare system means. People keep saying like you may hear someone say something like the death rate is like at 1% for coronavirus. That's true. That's accurate. It may be 3%. Let's say if it's 3%. But it's not that those 3%. Well, if you're talking about the United States too, if you're talking about, you're talking about what, 4 million people, if that happens, about, they think 160 million people, you do the math, you do 3%, talking about like 4 million people. But even without that, let's just take out the horrible, let's just let 4 million people die, almost 5 million people die, right? Let's just take that out of the equation. What about the people who are going to suffer during a pandemic like this or run on the healthcare system are the others who can't get hospital beds? So that car accident where someone was going to survive but can't get into a hospital bed to get treatment, that person is going to die. That person who might have had a mild heart attack, who would have survived if they were able to get to a hospital bed, are going to die. So that multiplies the amount of people who are going to die. It's just not the people who are going to die from the virus. It's going to be all the people who die because of the virus. It's going to be all those people who die because there's somebody with the virus in their hospital bed. Those are the people who are going to die. Some people who are never infected are going to die because of this virus. That's what's happening in Italy right now. In Italy, that's what's happening. That's what's happening in Italy right now. People are dying. People are dying because there are no hospital beds for them. That's the problem. So I was talking to somebody earlier. I was saying, this is going to be, you know what this is going to be like? This is going to be like, for the next 12 months, 12 to maybe 18 months, we're going to be living in a world that is like we're living in the time before the healthcare system, before we had healthcare, before we had modern medicine. It's still going to be here, but you will not have any access to it for about 12 months. So the question is, can you and everybody you know survive 12 months without needing a hospital bed at some point to survive? Because, like, for instance, my mom goes to the hospital about 3 times a year. And each time it's for maybe one of her, for diabetes or something else. So if she can't get access to a hospital one of those times, it's possible she won't make it. It's possible. For somebody who goes to the hospital 3 times a year, that's a problem. Why do you tell you to shelter in place? Because it's going to be less likely you get into an accident if you're staying at home than if you're out there on the road. That's why shut down everything. So what we are looking at is a situation where we'll be living in the next, again, I think 12 months, maybe six to 12 months without modern medicine. We just won't have access to it. Why? Because they're going to be taking care of millions of coronavirus patients and trying to keep some semblance of the system alive. So if you look at what they did in Wuhan, China, they literally built more hospitals. If you look at what's going on in Washington, they're building hospitals on soccer fields. They are building hospitals right now. New York State is building a hospital at the Jacob Javits Center. That's what they're doing. They are building a hospital at the Jacob Javits Center. That's what they're doing. Matter of fact, they're building, I think, 4 new hospitals: Westchester, Suffolk, Nassau, and the Jacob Javits Center. And they said they need like 2 more. So it's they need help building hospitals. So people, a lot of people are saying we should use the South Korean model. But I laugh at that because I said, how can we use the South Korean model when South Korea has 4 times more hospitals than we do? It's just not going to happen, right? South Korea has 4 times, not 4 times more hospitals, 4 times the capacity. They have 12.3 hospital beds for every 1,000 citizens. Their capacity is 4 times bigger. Amazing. But we'll see what happens. I feel like Debbie Downer. I feel like I'm driving everybody down, but that's just what it is. Let me see what's going on with Trump. They're still he is still. No, let me put the White House on the screen. We put up the White House. Where are we at? Chrome tab. Let's do Trump's press conference. Let's see what they're doing there. They're just making us wait right now. This was supposed to start at 5 o'clock. I don't know what's up with Trump. I think my camera went out. Is that why he's not here? Heretic is saying Trump has been diagnosed positive. Fake news, Heretic. Fake news. I think it's fake news, man. I think you're trying to set me up. I trust no one. You're at least now going to make me Google this, huh? You're going to make me Google this, Heretic? It looks as fake news, baby. Yeah, I assumed it was fake news. Even if he did test positive, I don't think they would tell us. Yeah, he probably wouldn't tell us. Heretic's trying to break news tonight, but it was fake news. So what do you think he's going to say? What do you think Trump is going to say? Let's see the updated New York numbers. I don't know. You know what? I would like to ask people, what do they think? The numbers went up a little bit. What do people think about you get a question? Yes. Let me see. No chance they'd tell us he is more. Yeah, I don't think they'd tell us if he was yeah. Rand Paul tested positive. Yes. Trump, Heretic was playing a joke. That was fake news. Let's see what's going on with my cam. My cam went out. There we go. All right. We're back on. Technological difference. I said technological differences. Technical difficulties. All right. Trudeau might be positive. Yeah. Oh, Trudeau. That's crazy if he is, though. If Trudeau's positive. That's crazy. Matter of fact, I should get the expert in here. Where's Fiona at? Fiona, are you watching? I guess she get this. She's like, you go to Discord and see if I can get her behind up in here. Got somebody with a PhD in this shit. So you bringing them in here? Why am I just? I'm talking to the void. Let me ship Fiona the link. Just ship Fiona the link. She explains this stuff so well, so it'll be nice and easy. Oops. Let me see. Okay. All right. Shipped out the link. Any questions for me? Here we go. Fiona, what's up?
Hello.
Everybody can hear you. What's going on? How you doing?
Okay, I'm doing okay. Just been watching you going through your numbers and your conservative estimates.
That's right, baby. Somebody's they would say the swine flu. Remember the swine flu? It was not that serious.
Yeah.
No.
The thing was, for swine flu, 1, there was a vaccine. 2,
that's true.
The infectivity wasn't quite as high. We have no immunity to this. Nothing.
Well, can you go over, like when you were talking about R naught before? Can you go over what you were talking about in the sense of how this compares to like the Spanish flu and what's the other one? And you said measles, the Spanish flu, and some of the other virulent pandemics. You said look at the R naught number, and you found out something interesting about R naught. Go ahead.
Okay, so the most infectious disease that we know of is measles. Okay. So the R naught value is 12 to 18. Now, that value represents the number of people that one person can infect. So the higher the number, the higher the transmissibility, okay? So measles is a nightmare, 12 to 18. Okay. The SARS epidemic back in 2004, I think it was, that had an R naught value of 2 to 5. Okay.
Mm-hmm.
COVID-19 has got an R naught value of 1.4 to 3.9. Okay. I remember we're dealing with a new disease here. So there's so much about it that is unknown. The pandemic strain of flu, which hit in 1918, that killed upwards of 50 million people, and it's thought to be as high as 100 million or over. That had an R naught value of 1.4 to 2.8. It was less transmissible than COVID-19. So, because we don't have a vaccine for this, we don't have a treatment for it, and the fact that it can survive on surfaces for as long as it does makes this a nightmare. We're just really, really lucky that it isn't a virus that has a high death rate as well. In the last Ebola outbreak was a 40% mortality rate. It was actually quite low compared with previous Ebola outbreaks, which have been up in the 90s. So we're lucky on this one that the upper estimate is about 3%. So given the way that this is able to spread, we are lucky that it's a 3%. and not a 15% or a 20%. Because this thing is spreading like wildfire.
Now, you've been looking at the curve. You know what? Give me that link, and I'll go through that. Like when you told what you showed us last night. I think that's really interesting to show how you can kind of predict some future events just based on the angle of the curve. Send me that link.
Is that the one where I've been doing my daily estimates?
Yeah, where you're going where you say go to the bottom right-hand corner.
Yeah. Okay, hold on. Right, I'm going to put the link into the live chat. Is that okay?
Yeah, that's fine. I'll grab it.
Okay. So this is the link that I've been using.
And everybody else can follow along. Just click that link and everybody can just follow along what we're doing. I'll put it up on the screen for those of you who are too lazy to click the link or who have, not that great service like I do right now.
Now, if you go to that link.
Hold on one second. Let me pull up the link. I've got to find my own stream. It's funny because I get no notifications for it. I'm like, they notified me. Like, yeah, you started a stream. I would want to know. But they probably said, dummy, you do know. All right.
So if you've all pulled up that link,
hold on, Fiona.
You still not got it.
I gotta stop the stream. Then I gotta. There's a lot going on here.
Do you want it in Discord instead then?
All right. See, I'm even listening to you saying go pull up the link again. All right.
It's in your Discord.
No. I got the link now. Right. Now you maybe. I was committed to it. I was committed to getting that link off the live chat. That was it. I was getting it. All right. So we up.
Right. So if you look at that, hold on, you look down bottom right hand corner, there's a graph.
Let me share the screen first. Sorry, I got you talking. You was in it too. I heard you. You're like, go right to the right. I was like, shit. I didn't want to stop you. All right, here we go.
This is sad because I know all off by heart. Right now, for that wee box, click on the top right hand corner of the box to maximize. Right. Mm-hmm. Now click on the circle underneath the graph that says mainland China.
Okay, we're clicking that. That disappeared.
Right. Now click on the total recovered.
Okay.
Right. So now this is the numbers for the rest of the world minus China. Okay. Mm-hmm. This is how it's progressing. You can click on logarithmic because this is an exponential curve. If you click on logarithmic, you should end up with a straight line.
Okay. So I got to click the mainland China off.
Yeah, just take that. Yeah.
Oh wow.
So,
look at
right.
that.
So there you go. So there's your straight line progression on a log plot of it. So you can use that and a ruler, and you can extrapolate the following day's numbers. Now the very last point on that line, this is today's dot, and they've not finished adding in all the numbers. So that'll continue to go up a little bit until they're finished for today. Right.
So have you tried to predict the next day's numbers?
Yes, I've been doing that. If you go back to the actual plot, right?
Oh, so hold on, let me go back to the
come
actual
off the
plot.
log. Yeah. Okay. Now, if you look at leave out the last point.
Okay.
And then the 3 points before it.
1, 2, 3. This one.
Right. You got a sort of straightish line. So use a ruler and just extrapolate up to where you think that will be for today in a straight line. And I think my estimate for that is 260,000.
Today?
No, that's what it'll be tomorrow. For my time point for this is round about 9 a.m. East Coast time when I have a look at the number. So my prediction for today at 9 a.m. was 222,000, and it turned out to be 223,000.
So your prediction for tomorrow
is 260.
And you predicted that for 9 a.m.
Round about 9 a.m. once they get all the overnight figures in, etc. And when they finally put on the following day's little dot, which will be on a horizontal line, Once they've done that, then I know I've got the final figure for that day. So I'm going for 260,000 for tomorrow. And that, seriously, that is just using this graph and the cardboard straight line from a cigarette paper packet. That's it. I'm not calculating anything. I'm just following the curves.
Now, I'm assuming you've probably predicted a couple of these. How have your predictions been in the past?
I started doing these predictions when the world number minus China was 30,000. And my predictions have been pretty spot on. Do you see where the wee kink is in the graph?
Yeah.
Right, I got that one wrong. I didn't expect this really low number. Don't know what caused that low number. But there you have it. But all my other predictions have been within about 1,000, maybe 2,000 now that we're getting to the higher numbers of the actual values. And as I say, a cigarette paper in that graph. And if a wee woman in a cottage in Scotland can use that graph and a cigarette paper to work out the next day's numbers and not be that far out, then you have to wonder how come nobody saw this coming.
Well, I think they've worked out. I think that's the reason why we're sheltering in place. You know, it's funny. Somebody was telling me, they were like, oh, you know, I think I was talking with a Trump fan, because don't get me wrong, I'm not really too high on Obama either. I'm a really big swing voter, so I do swing back and forth. But it's like, I remember swine flu, and I remember all these other pandemics and everything that comes out, and it was never a problem. Now all of a sudden, I'm sheltering in place. So what do you think? Now, I hate to even be political, but do you think there's some things that could have been done? Because on one end, this seemed to have kind of snuck up on us out of nowhere, but then on the other end, it really didn't, because it was, you know, China kind of reported it early. So that's what I'm saying. It's like, what do you think could have been done to prevent this? Because right now, they're predicting thousands of people are going to die, like in the next 7 days. But what do you think could have prevented this? If this is the BK?
Testing. That's what it was. I think things went a bit, it fouled up because you really got a worst case scenario. When it first popped up in China didn't know what they were dealing with. It could have been a virus, it could have been a bacterium, it could have been a toxin, it could have been a terrorist attack. They didn't know what they were dealing with. All they knew was that they had a small cluster of sick people, and they didn't know what had made them sick, right? No idea. Mm-hmm. So they had to then do the legwork to find out what was causing it. They found there was a novel coronavirus, and they published the sequence of the virus on the 11th of January. Right. Now, the other thing is, they initially thought that there wasn't person-to-person spread.
Yes.
Because usually with viral diseases, if there is person-to-person spread, you're about 7 days between exposure and symptoms, okay? Especially with these, respiratory viruses. This one is up to 14 days. And in fact, the longest incubation period on record at the moment is 27 days. Somebody took 27 days before they got sick. So at the end of, say, a week, they haven't seen an increase in the number of cases, and they think there can't be person-to-person spread because the numbers haven't gone up. Not knowing it was still in the incubation period, because with this being a brand new virus, they don't have that information.
So hold on. I hear people talking. Sorry. I thought the jump was coming in, but it was a janitor. Janitor walked through the door. let me see. So just so everybody can see, Rand Paul is tested positive. This is a little old news in day and age, but yeah, first senator happens to be a Republican.
So the problem has been that China didn't know what they were dealing with. Okay, so there is going to be a delay when you're dealing with the unknown. Okay, but they did try and hide it, and they did try and suppress it. But having said that, I heard about it.
Fiona, they started it up.
Ooh.
We get to listen to Trump. Share audio. They ran into the room. Here we go. Go ahead, finish your point. I'm sorry.
So, yeah, they did try and hide it, okay? They didn't know what they were dealing with. There was a delay there. Their testing procedure, the test they developed wasn't very good, but they were guddling in the dark. But it's at that point when I heard about this, and I heard there was 27 cases in China, and I must admit, I thought, oh dear, I don't like the sound of this, because 27 cases means you're talking about person-to-person spread then.
Yeah.
If I was able to say, oh dear, I would expect the experts to be doing exactly the same thing. And they were. There were intelligence briefings on this in January to all governments. The World Health Organization had been informed by China. The World Health Organization developed their own tests. So where did it go wrong? Oh, here he comes.
Uh-oh. Cutting you off. Ladies and gentlemen, the President of the United States.
Just before we begin, I want to mention we're working very hard, long on getting
You can hear him, right?
people out of Peru. We've removed some, and the rest are being removed with the cooperation of the Peruvian government. And we're also dealing with Honduras on getting some people out that got caught up, and we are working on that very well, again, with the Honduran government's work, and they're working with us. So I appreciate that. We have a couple of other locations that we'll report to you, and we were able to get a young woman released from a certain area who was being horribly accosted, horribly treated. And we spoke to General Milley. General Milley took care of it. We went in and we got her out. And we'll report further on that one. But it's that was rough stuff. I want to thank General Milley. I want to thank all of the people that were involved and the people that went in to get her. I want to thank you very much.
He's talking about a commando
As we
raid.
continue to marshal every resource at America's disposal in the fight against the Chinese virus, we're profoundly grateful to our nation's state and local leaders, doctors, nurses, law enforcement,
The Chinese virus.
and first responders who are waging this battle on the ground. It is absolutely critical that Americans continue to follow the federal government's guidelines, so important,
So important.
about social distancing, non-essential travel, and hand washing. Defeating this unseen enemy requires the help and commitment of every single American. I want to just say that Senator Rand Paul, a friend of mine, he's been a great friend of mine. He's been always there when we needed him, when the country needed him. And as you know, he just tested positive.
Rand Paul's tested
Jose
positive.
Diaz-Balart, spoke to him yesterday, tested positive. And
Second guy, I don't know.
They're getting quite close to home. And it's a terrible thing that's going on. The hidden enemy, I call it the hidden enemy. And I think they'll all be fine. I hope they're going to be fine. But I just want to send our regards. And I think I can speak on behalf of our country to those two great friends of mine.
Yeah.
We're working urgently with Congress on legislation to support the millions of workers, small businesses, and industries who have been hit hard by the virus through no fault of their own. Our goal is to get relief to Americans as quickly as possible so that families can get by and small businesses can keep workers on the payroll.
It's about businesses.
This will help our economy, and you will see our economy skyrocket once this is over. I think it's going to skyrocket. This
can't be good for business at all.
Built up demand, and I guess you really have to say who knows, but I think it's going to be a tremendous day when we win this war, and we will win the war. We want to win the war with as few, if you look at it, just deaths as possible. We want to have as few number of deaths as possible. Today, I'm announcing action to help New York, California, and
No,
Washington
it's making a choice.
ensure
Death,
that the
you
National
know,
Guard
life
can
over the
effectively
economy.
respond
Life
to
over
this
the
crisis.
economy. That's what he
The
said.
National
I'm choosing
Guard is a
life.
tremendous people. They're fully on alert. We've signed what we had to sign, and it's been activated. We're dealing also with other states. These states have been hit the hardest. Actually, pretty much by far, you could say the hardest. Everybody can see that. Just look at the numbers.
Yeah.
And through FEMA, the federal government will be funding 100% of the cost of deploying National Guard units to carry out approved missions to stop the virus while those governors remain in command. So the governors locally are going to be in command and will be following them. And we hope they can do the job. And I think they will. I spoke with all three of the governors today and just a little while ago. And they're very happy with what we're going to be doing because we'll be announcing some other things for those three states and some other states where it's hit the hardest.
Yeah.
This action will give them maximum flexibility to use the Guard against the virus without having to worry about costs or liability and freeing up state resources to protect the health and safety of the people in their state. The federal government has deployed hundreds of tons of supplies from our national stockpile to locations with the greatest need. In order to assist in those areas, I approved the state of New York's request for a major disaster declaration, something which Governor Cuomo has been asking for and which I agree, and we had it done in very rapid fashion.
5% of all new
We
cases
approved this on
in New
Friday
York
evening,
State.
and we're working very, very hard to get all of these things not only signed up, but completed and finished and win. The request from the state of Washington for a major disaster declaration was approved just a little while ago, went through the process, and we moved it very quickly. The request from the state of California was just received, and we will have it approved very quickly. We'll be working. I told that to Gavin Newsom, and we're working on getting that done very quickly. It'll be done maybe tonight. We have large quantities of medical equipment and supplies on the way based on all of this to those states, including respirators, surgical masks and gowns, face shields, coveralls, and gloves, with large quantities already delivered to Washington and to New York. In addition to large quantities of supplies, I've also directed FEMA to supply the following: 4 large federal medical stations with 1,000 beds for New York, 8 large federal medical stations with 2,000 beds for California, and 3 large federal medical stations and 4 small federal medical stations with 1,000 beds for the state of Washington. The governors know.
That's not enough.
En route to California and New York will be
That's
delivered
good, but that's
within
just
the next
not enough.
48 hours. In addition, the Naval Hospital ship, the USNS Mercy.
We need more beds.
It's incredible ships. These 2 ships are incredible. One on the West Coast, one on the East Coast. Will be deployed to Los Angeles to add emergency surge medical capacity, and they have a tremendous capacity. They are.
But
really
say something's better than that. He can't,
I will say that
1,000 beds is better than 0. That's, those are thousands of lives we're talking. We're talking about thousands of lives. So
now those numbers have gone up.
Thank God he's
to be
doing
a little
something.
bit more exacting. We've done a presidential approval for request for major disaster declaration for the state of New York. Approval of Title 32 National Guard activation for the state of New York. We're providing all of this at no cost to the governor. I spoke with Governor Cuomo. He's working hard. We're all working hard together. The relationship has really been amazing. But it also enables the governor to provide robust National Guard support to the state. And the 25%, we're going to be waiving that 25% cost. We're picking up, we'll be coordinating, and they'll be doing something with very special people. Mission assignment of the U.S. Army Corps of Engineers to provide support to build out alternate care sites. They're doing various alternate care sites, which have now been designated by New York.
Increase this again. This is increasing the hospital capacity.
Medical stations of 1,000 beds. These are very
they have
complex.
They got to increase the. They got to increase.
And,
Those number of beds. That's the only way you're going to get past it.
strategic national
too late.
stockpile order, and this is as of a number of days ago.
They're too
So
late.
far delivered to New York, and this is the 19th. We had the N95 respirators, 186,416 delivered.
They playing catch up.
We've delivered 444,078 surgical masks. Many have been delivered since then. Face shields, we've delivered 84,560 face shields. Surgical gowns,
Damn, he's swearing his words.
68,944 to New York. Coveralls, 352. Gloves, 245,486.
He reading off the numbers.
Also to New York, in terms of what's been delivered just since then, the numbers are quite large, and we have tremendous numbers of companies also making equipment.
Those numbers were large. You would have said them. What's
For
up with the
the
numbers?
state of Washington, we've delivered 369,000 N95 respirators, 507,406 surgical masks. And this is as of about 3 days ago.
They delivered it 3 days ago.
Face shields, 63,788 face shields. Surgical gowns, 107,850. Gloves, 240,376. And we have many things pending. It's actually not pending. They're being fabricated.
See, this is a mental game. He's reading off all these numbers.
Now,
You
for
know,
Washington,
that's a lot of
so we
numbers.
have 4 small federal medical stations, 250 beds. And for Washington, state of Washington, we have 3 large federal medical
Remember,
stations.
like I was saying earlier,
750
it's all
beds.
about the capacity of
And
the
then you have,
healthcare
as I said,
system.
the
That's what he's
approval of
talking
the
about.
Title 32 National
You need more
Guard.
beds.
State of California, again, to be very precise, we're going to have the approval of the Title 32 National Guard activation. And we're providing all of this again, like in New York, at no cost to the governor, meaning to Governor Newsom and the state, no cost to the state. It enables the governor to provide robust National Guard support to the state. So they're going to have control of the National Guard. Federal government sending, these are incredible people that are being sent. We have 8 large federal medical stations with over 2,000 beds, and that's going to California. And then strategic national stockpile order. We've ordered likewise hundreds of thousands of different items. I won't go into the exact numbers, but the numbers are very substantial. But we're having tremendous additional numbers sent. And whatever the states can get, they should be getting. I say we're sort of a backup for the states. And some of the states are doing really well, and some don't do as well. The ones that don't do as well need more help. But these are 3 states that really do need help because they are they are hit very hard.
Damn right. New York
And
has
the
half your
outpouring
cases.
From the private sector has also been extraordinary. I'm pleased to report that Honeywell, great company, has just announced it will immediately expand its personal protective equipment manufacturing operations in Rhode Island
Nice.
to produce millions of additional N95 masks. They're very hard to get. They're actually quite complex. For the U.S. government's strategic national stockpile, they'll be immediately then delivered to the various states.
Nice.
This expansion is already underway, and it's going to provide a lot of jobs for that state, probably around 500. The masks will be distributed by the government for the use of the health, safety, and emergency, and this for response workers, primarily for response workers. These are very high end. This expansion is in addition to Honeywell's action to more than double production of its existing personal protective equipment manufacturing plants. They make a lot of different things, and they're doubling and tripling their production. They're going round the clock. Today, I'm also announcing the launch of a new public-private consortium organized by the White House, the Department of Energy, and IBM to unleash the power of American supercomputing resources to fight the Chinese virus. The following
Still those shots
leaders
at
from
China.
private industries,
Still throwing
academia,
shots.
and government will be contributing. And they're going to be contributing a lot of different things, but primarily computing resources to help researchers discover new treatments and vaccines. They'll be working along with NIH and all of the people that are working on this. But tremendous help from IBM, Amazon, Google, Microsoft, MIT, Rensselaer Polytechnic Institute, the Department of Energy's National Labor Laboratories, the National Science Foundation, and NASA. They're all contributing to this effort, and they're fully in gear.
I'm trying to save
This
millions of
afternoon,
people.
I also want to update you on the steps we're taking
That's
to
what this is
protect
about.
and serve our country's 18 million veterans. These are great people. Our amazing veterans have shown their eternal loyalty to our nation, and this is the time
They're preparing
where they're
for
in
it.
need, and we are going to show our loyalty to them. We're being very protective of our veterans. We're working
2.8
on
hospital beds
certain
per 1,000 people. This is a
hospitals
problem.
where we may be
This
doing
is now
some
a problem.
work in Louisiana in particular and some other states, veterans hospitals. Going to be very protective of our veterans. Some of them are of that very vulnerable age, and some of them obviously are not feeling well. And some of them are still suffering the wounds of war from many years ago. Yesterday, I signed vital legislation to ensure that the GI Bill will cover distance learning during this emergency. I also spoke with many of our veteran service organizations, or the VSOs, to describe our unprecedented action. In February, the Department of Veterans Affairs established 19 emergency operation centers throughout the country. One of the things that they've been trying to get done for many years, you all know this from following me over the last number of years, but we got it done pretty quickly. They've been trying to get it done for many, many decades, was choice, veterans' choice, and also veterans' accountability. Now, if it's crowded within this, if they can't get to a doctor, we have great doctors in the VA. I have to say that we have fantastic doctors, as good as they come, but it's hard to get to them because of what was bureaucracy, but no longer bureaucracy. We've done a lot of things in that case because of accountability. When people aren't doing their jobs, or if they're bad, or if they're sadistic, or if they steal, or anything bad happens, we're now allowed to fire them for. I signed that a year and a half ago. For many years, you weren't able to do that. So the VA is working, and I was just told by our great leader at the VA, Robert Wilkie. He said for the first time, we get the highest marks in the history, highest poll numbers in the history of the Veterans Administration. Came out a week ago that they're happy. And look, one of the reasons that happened, highest in history, one of the reasons that happened is because of veterans' choice. If they have to wait online, they go and see a private doctor, and we pay the bill. And they get better. They don't have to wait 2 weeks and 3 weeks or 2 days, but they get better. And a lot of times they waited so long that they would have a problem, and it would end up being terminal because they couldn't get the kind of treatment that they deserve. So highest poll numbers, highest approval numbers in the history of the VA.
He said this is the third time he said that. Like, can we move on to the next part of the speech?
Restricted visitors access to 135 veteran community living centers, which house nearly 8,000 veterans with chronic medical conditions, so that we limit their exposure to the virus. We want to totally take care of our veterans. And that's what we're doing. The VA has canceled most elective medical and surgical procedures. They're delaying them till after this is gone.
Yeah.
After we've won. We began providing life-saving care to patients who had symptoms across the 171 VA medical centers nationwide. That's a big deal. Under my administration, the VA has also been a leader in expanding telehealth. Telehealth is becoming a bigger and bigger factor in medicine. This month, we have taken bold action to cut through the red tape and make telehealth available for millions more Americans during this crisis.
This is like a campaign speech.
From the safety of their home, rather than risk becoming infected or making a tremendously long trip. When, frankly, you'll speak to a great doctor right from your home.
Right now, they're trying to do this two ways. Build hospitals to save lives and keep people home to stop infection. That's what's going on right now.
We continue to accelerate the development of safe and effective vaccines. We're also aggressively investigating a number of antiviral therapies and treatments to determine their potential in reducing the severity and duration of the symptoms. And you know how I feel, because how I feel is on Tuesday, they're going to be starting it on Tuesday morning. And
Uh-oh. How about this
gonna
feeling?
have,
This
some
FDA's
medications delivered that we're going to see if they work. They certainly
okay.
are effective in other ways, and they are safe from the standpoint is that they're not killing people. We're not going to have that. So a lot of great things have been happening in that regard.
A lot safer.
I just wanna
They're not
finish, and
killing
then we're gonna
people.
ask a couple of people to say a few words.
You don't
that
have to
been
kill
so
me
much
to,
at the
to be
forefront
bad for me. You know,
of
you
this
put me in a coma
incredible
forever.
job that we've all been
I
given.
think I need a
But
little bit
wanna
more
say
better
that I know
vaccine than that.
this is a
So as long as you're
challenging time for
alive,
all
nah.
Americans. We're enduring a great national trial, and we will prove that we can meet the moment. I want to assure the American people that we're doing everything we can each day to confront and ultimately defeat this horrible, invisible enemy. We're at war. In a true sense, we're at war, and we're fighting an invisible enemy. Think of that. For those of you who are feeling alone and isolated, I want you to know that we are all joined together as one people, eternally linked
Unity,
by our
baby.
shared national spirit. We love our country.
Yeah, we'll get
The
through this.
spirit of courage and love and patriotism. No American is alone as long as we are united, and we are united. We're very united. People are saying things now that 3 weeks ago, they didn't talk that way.
That's true.
We're very united. No force is equal to the strength of really a unified America, united America.
And behind
America
you.
like we have it right now.
But we need you to come through.
For those worried and afraid, please know, as long as I am your president, you can feel confident that you have a leader who will always fight for you. And I will not stop until we win. This will be a great victory. This is going to be a victory. And it's going to be a victory that, in my opinion, will happen much sooner than originally expected. It's now attacking, the enemy is attacking 144 countries at this moment. 144, that's unthinkable. There's never been anything like this. And it's vicious. It is vicious.
Yeah, this is tough.
Some people recover well, and some people have a hard time. We all know that. But we will be totally victorious. We will then get our economy up to a level that it was, and in my opinion, beyond, because that will be a pent-up demand. There is a pent-up demand.
Pent-up demand.
And a lot of great things will happen.
This has got to be
But
tough
I'm
for
very
poor
proud of our
Trump. It's
country.
destroyed everything.
I'm very
He
proud to
had
be
the
the president.
economy. No matter how bad you thought he
And,
was, you look at
just
the
something
economy.
that's just, you're very special people. So
Look
thank you
at it.
very much. And I'm going to ask, if I might, combination of Pete, why don't you start off?
Yeah, somebody got to
Please.
speak. Somebody's got to speak.
Thank you, Mr. President.
This guy. All right.
Just a little bit about what we're doing in Washington, California, and New York. We understand that the states of Washington, New York, and California are the areas with a steady increase in.
Did he say that somebody else wants to
virus
speak? He
cases.
didn't even introduce the
In order
guy.
to assist with
Thought somebody
additional
else wanted to
needs
speak.
identified in those areas, the state of New York was approved for a major disaster and declaration this morning.
Trump is funny. He's like, oh,
Washington State was
somebody else
also
back there want to
approved earlier
speak?
today.
Yeah, you
California,
man.
the
You rambling
request, the
on.
President will consider it
Yeah, I think Trump is
immediately.
tired.
We have medical supplies in
Trump
route
is
to these
funny.
states, including respirators, surgical masks, gowns, face shield, coveralls, gloves.
Now he's going to
Quantities
repeat the
already
same list
delivered
Trump already told
to
us like
both
3 times.
Washington, New York, and California.
Thank you.
And we anticipate additional supplies to be delivered within the next 42 hours to all these states.
That's a weird number, 42
Under
hours.
President Trump's unprecedented national emergency declaration on March 13, FEMA is assisting state, local, tribal, and territorial governments, including reimbursing eligible emergency protective measures taken at the direction or guidance of public health officials in response to this emergency. All 50 states, the District of Columbia, 5 territories, and 2 tribes are working directly with FEMA under the nationwide emergency declaration for COVID-19. With the assistance of the FEMA regional administrators who are throughout the country, we are working to address the needs of state and local officials everywhere. States, tribal, and territorial governments do not need to request separate emergency declarations to receive FEMA assistance under this nationwide declaration. The emergency declaration does not authorize direct financial assistance available to individuals such as disaster unemployment assistance or other needs assistance at this time. Just a note on the USNS Mercy. Based on analysis of potential needs for hospital beds on the West Coast, the decision was made that the USNS hospital ship Mercy would have the greatest impact in California. The Department of Defense has been given direction to dispatch it to Los Angeles immediately.
What the
DoD has
California that was
advised
like?
that the Mercy can get into position within a week or less of today's order. Even though there are more
California
cases
numbers.
right now in Washington, the projected needs for beds in California is 5 times more that of Washington.
Yeah, watch
The
this.
Mercy
Yeah.
will be used to take pressure off local hospitals, other medical needs, and not for treating COVID-19 cases. And finally, a little bit about the National Guard. The federal government continues to take aggressive action and proactive steps to address the COVID-19 threat as we attack the health and safety or protect the health and safety of the American people. It remains our top priority. The National Guard is especially posted and equipped to assist federal, state, local agencies while serving. In response to this unprecedented nationwide operation, President Trump has approved Washington, California, New York National Guard units under Title 32 status for the response. The president's action provide the nation's governors continued command of the National Guard forces, enabling states to use additional resources to meet the missions necessary in the COVID-19 response. The National Guard is a viable and responsive avenue to provide a much-needed asset that is state-managed and federally supported. And I want to be clear, this Title 32 activation does not federalize National Guard members. The National Guard is still under the authority of each governor. They will work in concert with the Department of Defense. And we've had a lot of disinformation circling, and I want to make sure it is understood that
This guy
is not
reads
martial
bad.
law.
He
Department
reads
of
bad.
Defense, by way of a mission assignment, will lead this task. And then finally,
Because
we
people
continue
thought
to
it was
respond to
martial law.
hundreds of requests from governors across the country and filling all their critical needs. Thank you.
Thank you, Peter.
Damn. He just read the same stuff that Trump just literally said. I don't think I'm ever going to be watching
Thank you,
another one of
Mr.
these.
President. Good evening.
Oh, this guy's
What I
good.
want to talk briefly about is
Talk
the
to
Defense
us.
Production Act, and to give you the overview here, using the full power of private enterprise and the full force of the federal government. My job at the White House is to make sure, tactically, working with FEMA and HHS, the American people, particularly our healthcare professionals, get the gloves, the masks, and all of the personal protective equipment they need. And I can tell you, sir, that since you signed the Defense Production Act, my job's gotten easier. And let me explain why.
So they all got to get up there and praise Trump?
The Defense Production Act.
Since you
in
did this, thank you,
context,
Trump. My job got
has
easier.
two
Like, what the
primary
fuck was that
functions.
for?
One is mobilization of the industrial base, in this case, the public health industrial base. And the other is allocation of resources, both from the supply chain to the manufacturers and from the manufacturers to the end users, such as the healthcare professionals. Now, what we're seeing on a purely voluntary basis, based on the leadership of this administration, we're seeing the greatest mobilization of the industrial base since World War II. And every day I'm working with organizations and companies, National Association of Manufacturing, the National Council of Textile Organization, and so on, in terms of building up rapidly our capabilities.
Here's a
to get
global
what
player
you need.
pandemic.
Now, let's think about what mobilization means. It can mean, for example,
For
repurposing.
everybody out
of
there,
factories.
understand
So
the choices
Pernod
that are being
Ricard
made here.
called us last
They're
week,
making beds.
and they had
Stay home.
3 hurdles they had
Don't
to deal
infect.
with. They called my office.
They
Had to
know
call the
what's
Treasury,
coming down the
FDA,
pipe.
and HHS to
They
clear the
wouldn't be
path.
building 1,000
We got
beds if they
that
don't think
done
they're going to
that
use
day.
them.
They started their
They
production
know what's
that
coming
day,
down the pipe.
moving from alcoholic beverages to hand sanitizers. And as we speak, a truck is moving towards New York, and
They
we'll
are
arrive
trying
there Tuesday
to slow
share
the
with
run
hospitals
healthcare
over 1,000
system.
gallons of sanitizer. So that would be a repurpose. A second example would be one that the president offered with Honeywell. Again, Honeywell called the White House asking for help from the president.
Oh my God.
And what they said is, look, we want to do this new factory in Smithfield, Rhode Island. They called me on a Friday morning And by that night, we had a contract in
hey.
to HHS. HHS flipped that immediately, and I had
Everybody's standing
Honeywell
with the hands
moving
crossed.
people and equipment from Massachusetts to that facility in Smithfield, Rhode Island, and we're going to have those masks produced within 30 days, moving on the assembly chain. So my point is, mobilization is repurposing, building up capabilities. And
I don't even know what this guy said.
The other portion is, of course, the allocation
What's he talking about?
of resources. Now, what I can tell you so far is that
You haven't told me
Production
nothing.
Act
You
has
told me a
given
lot, but he just told me
quiet leverage.
anything.
When you have a strong leader, you can take a light hand initially. And so what we've seen with this outpouring,
What the hell is when you got a strong leader? You can
volunteers
take a
from
light
private
hand.
enterprise, we're getting what we
What?
need without putting the heavy hand of government down. There will be possibly cases down the road, and the
You are the
manufacturers have
government.
actually
You
asked
asked
me
for the
to
stuff. He said,
literally
"Yeah,
do
we'll give it to
where
you."
some places in
government.
the supply chain, they may have problems that the White House will have to break through using the Defense Production Act. We won't hesitate to do that. The last thing I'll tell you is that I also get a lot of
still don't get
calls
this.
that are very disquieting. Brokers
Those
are
calls.
offering millions of items, whether they're goggles, masks, or whatever, and you go through 3 different brokers, tracing to a warehouse in LA that's allegedly got 10 million masks, and they want to charge you 7 times what they cost. That's price gouging. We are a message to the hoarders: if you got any large quantities of material that this country needs right now, get them to market or get them to us. We'll pay you a fair price. But if you don't do that, we're going to come for you.
People are
and make sure
hoarding
that
masks
doesn't happen in this country,
and hoarding
that would be a good
supplies.
use of the Defense Production Act. So I salute
Wow.
you, sir. You've made my job
They will be
easier, and I
seizing.
appreciate that.
That's huge. That's seizing
Thank you,
people's
Mr. President.
property.
Task force met this afternoon.
That's what they're saying.
As
If
we
you
do
don't
every
give,
day.
they're going to come to you, give you a fair
let me
price,
begin
or they're
today
going to
by simply
seize
saying thank you to
your
the American
property.
And thank you for the way that people across this country, 7 days into 15 days to slow the spread. The people in communities large and small across America are responding, are cooperating, are communicating, not just on behalf of their own health and the health of their family, but more importantly, on behalf of the
They
most
said,
vulnerable
"We
among
know you
us."
bought it. We know you bought it to
So,
make a
on
profit.
behalf of
We're
the
going to give you a
President
fair price. But if you
and our
don't,
entire task
and you know what the
force,
fair price is?
just thank
What
you
we
to the
say it
American
is.
people.
Who says who?
I also
you know,
want to express
they're
our
going to give you a fair
appreciation to
price,
the governors across the country.
or we will seize
President
your
today just
property.
announced action in
for the
New
greater
York,
good.
California, and Washington State as the latest demonstration that this administration will do
But
whatever
if
it
people
takes
need it to survive, though,
to support the leadership at the state and local level.
people need it to survive.
As
That's the choice
American
they're
people
making.
confront the spread of the coronavirus. The legislative efforts that are underway being negotiated on Capitol Hill as we speak, the bipartisan spirit that's taking place there, that's reflected in all of our interactions with state leaders around the country, is a great credit to the nation. But it should be a great encouragement to the American people that your government at the federal level, at the state level, working with courageous healthcare providers all across America, are coming together to meet this moment. And that is the way our system works. It's extremely important that the American people recognize that one of the things that makes America different is that we have a system of federalism, and that by putting FEMA in the lead, the president has emphasized that our response to the coronavirus is in the anthem of FEMA. It is locally executed, state managed, and federally supported. We want the people on the ground, the decision makers, to have what they need. We want states to be able to manage the unique circumstances in their states. And whether it be the legislation moving through the Congress or the efforts the president announced today, major disaster declarations, Title 32 on the National Guard, resources flowing, hospital beds flowing, we're going to continue to make sure that our states have what they need to meet this moment. Our task force continues to focus on the priorities the president's given us. They are testing, mitigation, and supplies. And on the subject of testing, as is evident to people across the country, testing is more and more available every single day.
But seizing the mask violate
the progress
the Fourth Amendment.
At this,
I don't know. This is an interesting question because
Americans
have been tested.
If they're going to give
and
you a
received
fair
results
price, then
in
it's kind of like
coronavirus
eminent
tests,
domain. But eminent
with,
domain, I don't
slightly
believe
more than,
has ever been argued for
than
any for
30,000
personal
actually
property.
testing
And I know for
positive.
property
There's a bit of an
for
encouraging word in
but
that for every American. Remember,
because
everyone
don't
that's being
forget they
tested
the
now, with
government can
exception of our
deprive you of
healthcare
property
workers,
with due process of
are
law.
people
So
that have symptoms
you
that
know,
make them think they
could you
may have
if
the
legislation is
coronavirus.
passed,
And
is
as
that
our
enough?
numbers come in
Or does due
consistently,
process?
because
Does
the
that 'cause
254,000
the legislative
does
process
not
is due
include all the
process?
local hospitals or all the
Or do you have
local
to
labs
have
in the state.
notice? And
It's
I don't know.
working out to be
It's
about 1 in 10
it's interesting.
Americans
I
who've
have to
been
see the law
tested
and see
thought
what
they
the
had
law is
coronavirus, actually had it.
and see what the
9
law is
out of
grounded
10
on.
did
I'll
not.
look it up though.
But
That's
we'll
a very
continue
interesting
to roll
question.
out the testing.
But they're like
to-
they will
to the
seize
American
them
people.
and pay you a
And
fair
we're working to make
price. So that sounds like
testing
eminent
happen
domain to me.
fast.
But
We expect from word from
or a
the commercial
version of it.
labs that we should be caught up on the backlog in testing by the middle of the week. And we are urging today, on the president's behalf, that all labs would prioritize inpatient testing. Let me say again, to all of the commercial labs in the country, you will receive guidance from HHS tomorrow. But on behalf of the president and the White House Coronavirus Task Force, we are urging all commercial labs to prioritize inpatient testing. We want people that have been checked into a hospital that are being treated for what they suspect to be coronavirus to receive those tests more quickly. Also, I'm pleased to report that yesterday the FDA approved an emergency authorization on a new test that should be in production by the end of March. It actually would be a coronavirus test, the results of which come back in 45 minutes. And we're also working, the FDA is working with manufacturers around the country to come up with even faster, more innovative tests. And as we told our governors in several calls this week, governors and state health officials should simply contact FEMA for the latest information on testing solutions. Let me also say, tomorrow when we gather at this podium, we'll be unveiling with Dr. Bob Redfield in the lead, new guidance for people
new
that
guidance.
work in law enforcement, first responders, people that work in what we call critical infrastructure in the country. It was in early March, the CDC issued guidance for people that were asymptomatic or did not have symptoms, but who had
Yeah,
been
I think they did.
exposed
They
to
did have the
someone
gold
with
seizure.
coronavirus.
When I went
We
from
gave
the
them
gold
guidance about
standard.
being able to return to work,
Executive
wearing a
order.
mask for 14 days. And tomorrow
Yeah.
at this podium, CDC will unveil in cooperation
But they
with the
paid them
Department
for
of
it. So
Homeland
yeah,
Security, new guidance, which will make it possible for people that have been exposed to return to work more quickly with by wearing a mask for a certain period of time. Let me also amplify a point on behalf of the president and on behalf of the State Department about Americans abroad. You know, one of the reasons why the United States is in a different position today than portions of Europe are, and China and elsewhere, is because the president suspended all travel from China. He suspended travel from Europe and the UK.
see,
and Ireland.
he talking about looking
State
that stuff
Department
back.
is working around the
That's
clock
doesn't mean anything
to
now.
assist Americans.
It's
who
already
may
here.
find themselves
We have to think
overseas.
about
They're able to
this
come home.
now.
There's no barrier to Americans coming back to American soil. They're screened when they come home through a series of airports. But we're aware that with flights being canceled, some Americans have found themselves unable to find a way home. And as the president said, we've been working very diligently through the State Department to make it possible. Their commercial flights have been chartered. We're also working with the military for a backup on flights. At this point, the State Department has brought more than 3,000 Americans back home.
That's good.
But
That's good.
speaking to the Secretary of State today, he wanted me to share a website and a phone number for any American that might be looking on from overseas. You can call the Smart Traveler Enrollment Program at 1-888-407-4747.
That's good.
Or
That's
you can
good.
go online at step.state.gov. This
Yeah.
will allow our embassies and consulates to gather important information about your situation.
Because just
and
imagine
work
if people didn't have,
facilitate
I know like
bring you
at
home.
the before
Let me
they closed the
say,
border,
finally, as
people
I
like had a
began,
very
let
short
me
amount of
close
time,
as the
and
chairman
those
or the leader
plane
of
tickets
this
went
White
hot.
House
So
Coronavirus Task Force. We are 7 days, and the American people are responding. Because as we speak about supplies, as we speak about testing, the most important American can do is heed the guidance and the direction from your state and local officials, particularly in areas where we have widespread coronavirus infection. elections, but for every American putting into practice these measures that the president alluded to at the very beginning of his remarks is a way that we can do this, America. We can lessen the magnitude of the coronavirus in our country with the cooperation, compassion, generosity, and prayers of the American people. We can slow the spread, we can protect the most vulnerable, and we can heal our land. So let's do it, America.
They're being very positive. They're being very positive. Oh my God.
Thank you very much,
Questions?
Mike.
That's what starts buffering here.
So, just
Here we
a
go.
couple of Little things that will take some questions.
There we go.
Maybe
This
we'll
is
have,
always the best part. The questions.
That'll be a shock.
Come on, they gotta. You know what's going on.
I have to say on the testing, if this works out, and we think
All
it
right.
will, the new test will be a very simple one, much easier. than
Trump and the
existing
questions.
tests,
You know,
which
this is always the best
quite
part of it,
complex and
Fiona.
not
Trump and the
a lot of
questions.
fun to take. And this will be but remember, we
Oh, my
inherited
God.
a
Don't
broken,
set me off.
obsolete system. It was good for a small number of people, but not good for the millions of people that we're talking about.
All right.
And we've made this into a system that no matter where you go in the world, that's where they're going. That's what they want to do. That's how they're going to be.
What's he
doing it. Should
talking
something
about?
Like this happen again. So our people have done a fantastic job, really a fantastic job. And I hope the
Huh?
new test works
Oh, the new
out.
test.
We'll know fairly soon, I think, Doctor. We're going to be knowing about that. fairly
Yeah, that
soon.
quick.
Hopefully
That test for
check out
that's
the
for a couple of
testing.
hours is supposed to be really
And,
good.
we certainly
Because
have
now it
full
takes a couple of
control
days
for
for you to
that.
get the
It'll be a
results,
very
but
simple
you know, days to
test
hours
by
is really going to be
comparison.
good.
Won't be unpleasant at all. And one other thing, the ships. So we have the Mercy, and it's going to California, as you know. That's on the West Coast now. And you have a sister ship that's essentially a twin. They're incredible. I mean, they're incredible ships. I've seen it.
And one of the more
Seen
dangerous
one
things
of
about
them,
this virus
and,
is that
they are
you can spread it
unbelievable
by
what
being
they can do in their
asymptomatic. Like, you know,
capacity.
so many people
Many
won't even get
operating rooms, you know,
symptoms.
they're wartime ships. They're meant for war. Many
So all
operating
that
rooms,
screening
stainless
people with
steel.
the for fevers
These
and
rooms are as
temperatures.
good as there is anywhere in the nation, actually. I spoke with Governor Cuomo. We had a great conversation today, a number of conversations, actually. He's working very hard. And we are going to be bringing that ship that's called the Comfort. So you have the Mercy and the Comfort. The Comfort's on the East Coast. And that ship will be coming over the next 3 weeks, 3 or 4 weeks. It was in the middle of maintenance, and we are moving the maintenance very, very quickly. And
Come on,
we're
Trump,
also
let's get the
supplying
questions
ships
here.
simultaneously. It's actually big supplies going into those
You've
ships,
mentioned the
big-
ships already.
and that ship will be coming up here over the next few weeks, and we'll probably be putting it in New York Harbor. And
Yes.
we're making arrangements for that also as to where it's going to be docked. So
We got
you
about
have
ships.
Mercy and
The
you have
ships are
Comfort that
coming.
be
We
up.
know.
The Mercy will start very, very quickly. It'll be arriving in Los Angeles.
Maybe we're just trying to just
So
like lower
look
the
forward to
boom for the
Okay.
questions. Here we go.
ABC. Go ahead.
Damn.
Thank you. First of all, Senator Paul testing positive. When's the last time you had in-person contact with him?
Gee, I think it was quite a while ago.
I know he's gonna be like, damn, the first question's a hard
Senator
question.
Paul, now 4 senators are in isolation, and the rules say that in order to vote, they have
Who
to
are
be
they,
there.
please? Who are they?
Romney, Senator Lee,
Senator Gardner,
Senator Gardner,
Senator
and
Rick Scott.
Senator Rick Scott.
You know who his
Also,
friends
2 of them
are
were in
now.
contact
I guess Rick is
with
coming
Rand
out.
Paul. With the critical stimulus package vote expected.
Romney's in isolation?
Yes.
Yes.
Gee, that's too bad.
Damn, you don't know Romney's in isolation?
Detect sarcasm there,
No,
sir?
no, none whatsoever.
Do you think that Congress should consider changing the rules to allow them to vote remotely if it comes to this critical stimulus?
I was thinking about it today. And
Yeah,
I'm
of
saying,
course, it was an
you
obvious
could
first
have a
question.
lot of senators and a lot of House members. I spoke last night with a very, very good man who happens to be in the House, as you know, and
Who's this good man?
he's just started and he tested positive. So you could have a large number of people in there from Congress. You could have between House and Senate, you could have a large number. And I think it's something, at least, I mean, I fully understand why you should be there. I think it may be a constitutional reason why you should, but we could be in a position where I would certainly be in favor of it, where they could vote from a certain outside location. I would be in favor of it. I was thinking about it today. I mean, we could be in this. Look, with what's going on, nobody's ever seen anything like this. You could have a lot of people in there from Congress, and it would certainly be. They may tell me there's a reason constitutionally, and there may be, but I would be totally in favor of it on a temporary basis.
Constitution may not allow you to
Negotiations still have
vote.
ways to go on the stimulus package.
Or
Are you
online.
concerned about the timing at all in the
Well,
best
we
interest
have
sense?
we have an interesting thing. You know, we all want to get to the same
Is
place.
it
but
unconstitutional
I have-
to vote
we want to, and I just
from
wrote
your
this down just
house?
a little while ago. We want to protect the worker very much. So do they. So do the Democrats.
Mhm.
We also want to protect the worker through their companies. We don't want to necessarily. We're going to help the worker anyway, but ideally they can go back to one of their great companies. You know, you have great companies that are in financial trouble now, and we need money to help those companies so they get back into where they should be. Health. You know, most of these companies 4 weeks ago were having the best year they've ever had. Last year was the best year, almost all of them, other than Boeing, which is incredibly had problems. Big percentage of GDP. But we have to be able to work with Boeing. Boeing was a great company and will be a great company again, I think, shortly.
Make Boeing
So
great
we have to work
again,
with
baby.
companies, and they don't
Make
wanna do
Boeing
that.
great
It's
again.
crazy. They don't want to do that. I don't want stock buybacks, so I don't know where the problem is there, but I know that's one of the things that they're talking about. I do not want stock buybacks. I don't want to give a bailout to a company and then have somebody go out and use that money to buy back stock in the company and raise the price and then get a bonus. Okay. So I may be Republican, but I don't like that. I want them to use the money for the workers. I want them to use the money for the company, help the company in the airline business to take care of their planes and all of the things they have to do.
You don't want to
Buy-
get caught out there
buy
like
new planes,
Obama.
but I don't want
You
stock-
don't want to get
so
caught out there
I don't
like
wanna have any
Obama.
stock buybacks. The Democrats are with me. I don't know what the problem is on that one because I can't imagine that is too tough. We want to be able to take care of our people. You're going to have things coming up. We're going to have some of the elements that they're talking about. They're down to, I mean, literally 95% of things that you would think that they wouldn't agree, and you'd think the Republicans wouldn't agree to it. And unemployment, as an example, is one of the things they talk about, and unemployment insurance. I think we're very close on that, but right now they're not. So right now they're not there. But I think that the Democrats want to get there, and I can tell you for a fact the Republicans want to get there. And I don't think anybody actually has a choice. It's a bold package. It's a big package. We do have money for one of the things is we do have money for saving small businesses. I don't imagine the Democrats, because we have a lot of money set aside for small businesses. We also have a lot of money set aside for big businesses. The big powerful
So this-
companies
all right.
that were powerful
In the
4 weeks
chat,
ago,
tell me,
and today
who
they're
remembers what the
overextended. Look at
question
the
was?
cruise line. That's a
What
tremendous
question
business,
is
a
he
big
ask?
business,
Is he
very important
answering?
to Florida.
Don't
And
go back.
It's
What question
unthinkable
is he
a month
answering?
ago. Just unthinkable. They
What
were
was the
setting all
question?
sorts of records. They're building new ships. We can't let the
I don't
cruise
remember
line
the question.
lines go out of business. I mean, that would be massive.
I don't
numbers of
remember the
jobs
question.
for our country, and actually for the world. But for our country, it's a massive business, and it doesn't take much to keep them going. So we have to provide for that. But I think both the Democrats and the Republicans are agreed that we have to take care of our workers, and we're going to be doing that in numerous ways, including a substantial cash payment. Yeah, please.
When it comes to the Defense Production Act, we know that governors across the country all day today were pleading with you to utilize the DPA,
Well,
saying that
depends
they
which-
need it
depends which governors
specifically
you're talking
for that allocation piece that you mentioned, Mr. Navarro. Why not use it now if that would answer their pleas for help?
Well, we are using it now. The fact that I signed it, it's in effect. But we're a country not based on nationalizing our business. Call a person over in Venezuela, ask them how did nationalization of their businesses work out? Not too well. The concept of nationalizing our business is not a good concept. But I'll tell you why. As Peter said, we may have to use it someplace along the chain, but we're getting calls. Here's the beauty of it.
Okay.
If we go out and we want, let's say, masks, we don't know who to call on masks, but Hanes, who makes things of cotton, various elements, lots of things, it's a great company. They called us and they said, we're going to make millions of masks. We got a call today from 3M. There's a big article today, the head of 3M. They're going to make tremendous products. And
Okay.
more or less in that business. And if they're not, like for instance,
So he doesn't
Ford
nationalize it.
spoke to us about doing ventilators. The beauty is they're calling us. If you go the national route, nationalization route, we're going to tell a company to make a ventilator. They don't even know what a ventilator is. In the case of one
What?
company, they used to make them years ago, and they know how to make them. You know, it's a very complex piece of equipment, frankly. So what we're doing.
What are you
is-
talking
I
about?
think
What?
Peter said it may be better than anybody's going to say it. We have the threat of doing it if we need it. We may have to use it somewhere along the supply chain in a minor way.
Okay.
We have millions of masks being done. We have respirators. We have ventilators.
So the
We
question
have
was
a lot of
about
things happening
businesses.
right
Now we're
now.
talking about
So
masks
just the
and
threat of using it, but using
the
it's actually a
threat
big deal. I mean, when this
of
was
using-
announced, it sent tremors through our business community and through our country.
are the
Because
threats.
basically, what are you doing? You're talking about you're going to nationalize an industry, or you're going to nationalize. You're going to take away companies. You're going to tell companies what to do. The truth is, most people, nobody would know where to start. There are companies out
Huh?
there that you wouldn't think of that have called us that say, we can do ventilators. We used to do them years
So he
ago.
signed the
And they
act,
can do them in large
but he doesn't want
quantities.
to use the act. He
Other
just
companies-
said
if I
he said he's
call
just using it
companies
as a
and say,
threat.
You build ventilators. They don't even know what a ventilator is. So it's really working out very well. One of the reasons I read the numbers to you is because we've given vast numbers.
What
of
is
just
this
about
whole
everything. We've
business?
taken it out of
All
our
right.
supply. Out of our supply.
Why would I ask
And
somebody
we're
who
restocking
doesn't
our
make
supply.
ventilators to make
But
force
we're
them to make a
really backing
ventilator?
up the governors. The governors have to go out do their things, and you have a lot of governors. They've done a fantastic job. You have some that haven't. Usually, it's the ones that complain that have the problems.
It seems like
But we've had a great
the
relationship,
Democrats
as an
want to buy
example, with Governor
stock in
Cuomo, with
companies,
Governor
and
Newsom.
that way trying to prop them up like
We've had a
that,
great
become like partial
relationship with
owners.
the
So
state
maybe
of
Trump is calling that
Washington. Those are three
nationalization
hotbeds. Those are three
versus
hotbeds. Now we're also dealing
just giving
with
them the
other
money
states,
and having
as,
them.
the admiral said yesterday, we're dealing with all of the states.
Let me see, neighborhood
actually,
in
one
Vietnam, the
form or
state
another. Some are
ordered
very,
its own
affected in a very
manufacturers and
minor
private
way, where you
companies
have
to
two
mass
people or
produce
three people,
masks,
and I don't even mean deaths. I
had
mean
them
literally
distributed
cases.
for either free or
Um,
fixed price, made
And
the
that's
police
different
distribute
than
them.
New York, where you have
Oh, wow. Wow.
tremendous, where everybody. I lived there for a long time. Everybody.
I don't think that's going to happen. I don't know.
And
It seems like
you have a lot
here,
of cases in New York. You have a lot.
do
of
we
cases in New
buy
York,
do we
and
buy
we're helping Governor Cuomo.
stock in the
helping
company,
Governor
or do we
Newsom.
just give them the money? I
They've
don't see
been-
why we
frankly,
wouldn't
they've
want to
been
buy
total
stock in a
gentlemen. They
company.
want to get it done, and we want to get it done. But doing it the way we're doing it is much better.
And then we allow them to buy back their stock.
I'm asking about the supply chain. It's about allocation, not about manufacturing. So the companies, it's not
But it
about
all comes from-
nationalizing
yeah, I
the
know,
companies,
you're
it's
right.
about
And
the
we-
allocation.
We
Yeah.
coordinate with the states, and we are coordinated with the states. And for the most part, the coordination has been very good. Look, 3 days ago, I had a phone call with all the governors. I actually allowed the press to stay. They weren't supposed to stay. And one
He-
person in the media said,
He knows
"That's
how to give a
surprising."
long-winded answer. I
It's
gotta
actually a
say,
little risky doing that because we had Democrats and we had Republicans, and
You're just thinking about it now.
politicians, and they always have something to say. Well, I took a lot of calls,
this
and
guy.
we really didn't get one
Yo,
nasty.
he
or
turns every question
bad
into a
response. They were
speech.
thanking us for the job we did, and I had the press standing. I don't know if you were there. I don't think so. I had the press standing there.
No, I
watching.
wasn't
They weren't
there.
supposed to be there, but I said, let them stand there. The governors were very complimentary, very complimentary. And I watched over.
Yo,
the
this
last
is
few days, Governor
hilarious.
Cuomo. I watched
He's been
Gavin
watching Cuomo.
Newsom in California. I watched both of them, and they've been, very complimentary. And those are really the hotbeds.
They've been
And
complimentary.
so we want to keep that going. I'm
So they want
very
to get the
proud of
compliments
this country,
going?
and I'm frankly very proud of a lot of the politicians that normally we're fighting. We have different views on things, a little different view.
He wants to keep
We're
the
going to get
compliments
to the
going.
same
What's
place.
going
We
on?
have different views, but we're going to get to the same place. Yeah, please.
Yes, I wanted to ask if you're considering an executive order to free elderly nonviolent criminals from federal prisons.
We have been asked about that, and we're going to take a look at it. It's a bit of a problem. But when we talk about totally nonviolent, we're talking about use of totally nonviolent prisoners.
That's
We
what
are absolutely
nonviolent
looking at that,
means.
yeah.
What do you mean?
Your administration eliminated a key position in China in July.
We're
A
talking about
medical
non-violent
epidemiologist
prisoners, like
embedded in China's
non-violent.
disease control
Yeah.
agency, and it was just months before the first cases were spotted in Wuhan. So the question is basically why the post was eliminated. And
Well,
if
I
that
could
triggered-
ask anybody. Would you like to take that one, Bob? But this is just like all of the other stuff that you not you, but that the press was asking, all of which turned out to be, we actually gave CDC more money, not less money. They said we defunded. It turned out it was more money. Every one of those things that were said were 100% wrong. And this sounds like another one of them, but anyway, go ahead.
Yeah, as you know,
As long as
CDC
they're
has
nonviolent.
offices all around the world right now to do our function to detect and prevent and respond to outbreaks where they occur.
Mhm.
The China office is actually being augmented as we speak.
Was it close?
And we've been embedded there for over 30 years. There's a
Mhm.
reason they call it the Chinese CDC because we've had that productive partnership.
It was being augmented.
And I wish,
He
again,
didn't say it
the
wasn't
relationship
closed.
With China is a very good
You
relationship.
should have
I
said,
wish
no,
they
we didn't
told us
close it. It's
3
still
months sooner.
open. He didn't say
Yeah,
that.
This was a problem.
Why didn't
We
he
didn't
just
know
say
about it.
that? Is the place
They knew
open?
about it,
Is
and
it
they should have
open?
told us.
He said
We
it's
could
being
have saved a lot
augmented.
of
What the hell
lives
does that
throughout the
mean?
world. If you look at what's happening in Italy and Spain and a lot of other countries, we could have saved a lot of lives.
What did he just?
So-
Did he answer
Mr.
that
President,
question?
Given the diagnosis
Is there a
for
Chinese
Senator
office
Paul
now?
and people being self-quarantined, what concerns do you have about the direct threat to the function of the Senate, the ability to get this important package that people are waiting for passed?
People are waiting for it.
And should Americans be expecting you to extend the 15 days, given the climate of how this is spreading at this point?
Well, I hope
Mhm.
we won't have to. It's possible, but we'll have to see how that works. As far as the Senate is concerned, we are looking at some, some of the folks are feeling very good. Some are quarantined, but they're negative. It may be totally fine. Okay. Others are positive. We're just finding this now for the first time. I mean, over the last 2 days, we found that.
Do you see it as a threat to the aid package that Americans are waiting for?
No, I don't see any threats at all. Honestly, I don't see any threats at all. It'll all work out. It is a question, and a very good question. I thought that we are considering. Now, I don't know if you can do it constitutionally,
Mhm.
but we are considering letting people vote, senators, congressmen and women, vote from a separate location, from a outside, namely a hospital or a home. depending on
Namely a
where. So we are
hospital.
looking at that.
What's
So
going
that's
on
the
in
quick question
Congress?
Most people would believe. but
They
we are
gotta
looking
say,
at that
can you
very
vote
strongly.
from a hospital?
He
made me nervous now.
Kelly was kind of alluding to it while we've been up here.
Can
They
he
weren't
vote
able to
from
get
a
the 60
hospital?
Votes to move the package for the cloture vote. I'm just curious, just your reaction. to
What the
that,
hell's
sir. And
going
then
on in
what is
Congress?
Mitch McConnell telling you and Secretary Mnuchin?
Well,
Are
we're
they-
dealing with them all the time, and we're dealing with Mitch. We're dealing with the other side. Everybody wants to get there. We'll see what happens. I think you'll get there. It's to me, it's not very complicated. We have to help the worker. We have to save the companies, because as soon as we're finished with this war, it's not a battle, it's a war. As soon as we're finished with this war, our country is going to bounce back like you've never seen before. But we have to get it to that position, and we have to make sure that those companies are whole, that they haven't been disbanded. Because if you do that, it's going to take much longer. So in a way, it's being penny wise if you don't. But we want to help the worker. We want to help the companies that the workers come from.
My
Because
arms are
if those
tired. His
companies
arms
go
are
out of
tired.
business,
That's
and
why he
that
stopped
includes
doing
small
that.
Businesses. We have a tremendous amount of small business work in there. You know that. Once they go out and they don't come back, that's a much longer.
That should be the
period.
headline for tomorrow. Trump
Sir, I
says
apologize. There was a
we are
woman
planning
that was
to have the
American
vote
that
from
was
hospital.
what was going on there, sir?
Bad things were happening to her in a certain country, and we're really under
That's what the bad
the
things.
feeling that we should keep it somewhat private until she's already been freed. And I have to tell you, General Milley and
She's kidnapped.
his
That's
people
bad
are
enough.
unbelievable. They were not playing games. General Milley does not play games. He's a very interesting guy. They got her out. They got her out of a certain country.
You know
where
what
she
does
was,
bad things mean?
seriously
Like, give it
abused,
private.
accosted, and
So why did you tell us it was bad
whatever
things?
the maximum word is, other than death, that happened. But we got her out. And she's okay, and she's back with her parents.
She can be
Can I
totally
ask you one question? It's something I've just been curious about. Previous crisis,
whatever the
like
thing
tsunami,
closest to death. That's where we got her
past
from.
presidents,
What?
They called their predecessors and said, "Hey, I need you to step in, do something like that." Do you have any interest in reaching out to Presidents Bush, Obama, Clinton, Carter, or talking to them? I'm just curious if
Oh
it's
my
something you
God.
consider or not.
Look, I have the best people in the world. I think we're
You have
doing
the
an
best people in the world.
extraordinary job. If you look in, let's say the
Mm.
H1N1,
H1N1.
you look at that whole That was a disaster. That was a tough period of time for our country. You look at so many
Like
other
this.
things that
No, it
weren't
wasn't like
handled
this.
very well,
It
whether
wasn't
it's
like
Katrina
this.
or something else. Look, I respect everybody, but I feel I
Respect
have an
them.
incredible team, and I think we're doing
You
an
do.
incredible job.
We have an incredible team.
When you look at the job we're doing, and all you have to do is look at the approval numbers on the job we're doing. I think we're doing an incredible job. So I don't want to disturb them, bother them. I don't think I'm going to learn much. And, I guess you could say that there's probably a natural inclination not to call. Now, if I felt that if I called, I'd learn something and that would
Mhm.
save one life, it would save one life. Okay, I would make the call in 2 minutes, but I don't see that happening. Please.
Can I ask you about the comments that a couple of your former aides have said today?
Okay.
Jared Cohn said, is it time to start discussing the need for a date when the economy can turn back on? Whereas Steve Bannon is saying, drop the hammer today on the virus. We're going to have to take the pain up front. We have to shut it all down.
I saw both.
I want to ask you about the tension between the economic pain we're suffering and, of course, the virus itself and the casualty and deaths from that.
Well, look,
Even
I'm of
Bannon
the
saying,
opinion we
shut
have
it
to do
down.
great during this 14 days, during the 15-day period. We'll know at the end of 14 days, pretty much, we're going to have a pretty good idea how we're doing. I think you have to shut it down and you have to see, but there'll be a
Shut it
point at
down.
which we say we're back in business. Let's go.
That
Those
point is
two
coming
statements
sooner.
are not mutually exclusive,
We're
you
talking about
understand. I saw
shutting
both
down
of them today.
society.
I think
And they
Just so we're
they
clear,
intermesh.
we're talking
More of a
about
shutdown
shutting
now.
He is
down
calling for
society.
a faster, just a brutal shutdown, and then open up maybe a little bit faster. So there's that fine.
That's what they're
fine line.
talking
Look,
about.
We did a big shutdown when we wouldn't allow people from China that could have been very seriously infected, that were, when we cut that off very early. And then we cut Europe off very early, as you know. So that was also very
When do you
early.
start opening Main Street
Well,
back
I
up?
can't tell you that. What I have to say is
Yeah.
that I think we're going to have good results. I
Before,
think the
remember, he
American
was saying it's
people
going to
have
be a
been
couple of
amazing.
weeks.
I think our
Now he
stimulus
said he can't tell you
package,
that.
will
Now he's
get
saying I
done,
can't.
and it will
Think
be a
about the
tremendous
change.
package.
They were saying 14
We're
days
really
before.
not-
They
I
were
mean,
saying
may
in
not
about a
have
month.
gotten those votes, but
He's
they're very
now
close to
saying,
getting a
I
deal done.
cannot tell you
So
that.
I'd be surprised if they didn't. And if they don't, I think
He's not even
frankly,
giving
the
a number.
American
He's
people
saying,
will be
I
very
cannot tell
upset
you.
with the Democrats because the Republicans are ready to approve a deal. So the only reason a deal couldn't get done is pure politics. Yes, please.
Mr. President, despite your differences with New York City Mayor Bill de Blasio, he says that the city is going to run out of basic hospital supplies by April. How do you prevent New York City from becoming the next Italy?
Well, he should have, the hospital systems
question.
in various places. Some have been stocked and ready to go for nothing for this. Nothing. This is beyond anything that anybody ever thought
No,
possible. I
we
think
know.
you could really say this. Nobody can really, doctor. Nobody can really say, "Oh, gee, this will happen." This is a very unique.
will
and
give you
hopefully
that,
will be
yes.
unique for many centuries. For a long time. Hopefully, we don't see this again. But
We know. We don't want to see it again.
The systems are supposed to be ready, willing, and able. They're supposed to be ready to go.
Okay.
We are helping them a lot. And I have great love for New
Mhm.
York City, and I have great love for New York State.
Mhm.
And we're going to help them a lot. I mean, I was just saying, we're sending our ships up there. We're sending more than just this ship. We may be using, if we need, we'll be using some of the cruise ships that you've been reading about. We'll be using them also because they're very immediate and very quick. They can be there very quickly. We have good docking systems in the places that we're talking
Using
about.
cruise
So
ships
we
for
may be using
hospitals,
some of the
people.
cruise liners that we're talking about.
Using cruise
But
ships
no, I mean,
for hospitals.
I think Bill de
That's what the
Blasio is
president's
working very
talking
hard. I
about.
think he's trying very hard. It's a tough
We are planning
situation
on using cruise
for,
ships for
him and
hospitals.
every mayor.
Easy turnover.
Because nobody
Trump has to be decoded, but that's what he's talking about.
You've given millions of masks. And you've
They are
given
going to be
hundreds of
using cruise
thousands
ships
of
for
masks
hospitals.
in a
They have
certain short
1,000
period
new
of
beds
time.
that are going up at the
And
Javits
then you hear
Center.
they need
They are
many, many
making more hospital beds.
one of the things they have started.
That
with
is what's
respect to
going
masks
on.
Is the sterilization process. Some are really, it works very well. Others aren't really set up that way. You throw them out. But we have a sterilization process that's working very hard. Speaking of that, hand sanitizers, when you asked the question on the
That's what he's
companies and
saying.
what's going on. We have many companies now, companies that made whiskey, that made alcohol. They've now gone very quickly into the hand sanitizers and all of, you've been reading about 3 or 4 big companies. We're doing incredibly well on that. There was no way if you took the existing companies that something like that could happen. But
Cruise
it
ships,
happens
huh?
almost, they'll call Peter Navarro or they'll call somebody. In
Cruise
one
ships are
case,
pretty
they
nice.
called me. They said, we can do this, we can do that. We've had a lot of those calls where companies want to. There's a company in New Hampshire, a great company. They want to make ventilators. I'd never thought of them for ventilators, but they do make metal equipment. And
He was
things
just
out of
talking
metal.
about how
They'll make
the
a great
government
product.
shouldn't, you know,
So, Peter, I
they
think
may
you've seen a
force them
lot
to
of
make
that.
ventilators. They didn't make ventilators. Now he's got a company who never made ventilators. I don't know.
The bill that is being contemplated by the Senate right now has a fund that has hundreds of billions of dollars for the Treasury Department to use to bail out states and localities, as well as specific industries such as cruises and hotels. Will you commit publicly that none of that taxpayer money will go towards your own personal
Well, every
properties?
time I do it, like for instance, I
Good
committed
question.
publicly that I wouldn't take the $450,000 salary. It's a lot of money, whether you're rich or not. It's a lot of money,
So, man,
and I did it. Nobody cared. Nobody said thank you.
does he
Nobody
want to
said,
take
"Thank you very
the
much."
questions about his
No,
corporate
I
welfare?
didn't commit legally. I just
Will
said,
he take
I
the
don't want
corporate
it. I don't want my
welfare?
salary. I work for zero. I don't want my salary. Nobody said, "Oh, thank you very much." But I guarantee you, if I ever took it, you would go out after me. You in particular would go out after me.
You think it
All
doesn't take a
crazy.
salary?
So I have no idea what they're talking about with regard to the one element. Everything's changing, just so you understand. It's all changing. But I have no idea. But every time I commit to do something, I committed to do many. Look, I ran and everybody knew I was a rich person.
He's a rich
I
man.
built a great company. And people knew that.
Will you
But I
take,
agreed
the
to
question
do
is, will
things
you
I didn't
take
have to.
government funds?
I still
Will
don't
you
have to.
take government funds?
But my
Will
company,
you
I
take
told
the
the
bailout
kids who
money?
were running it, I'm not running it. But I told them, don't deal with foreign companies. Don't deal. I didn't have to do that. I
Okay.
could have just ran, and I didn't have to do that at all.
Don't have to do any of that.
And instead of being thanked for,
Are you going to take the corporate welfare
again, not
fund?
agreeing to do it, but just for not doing it, I get excoriated all the time.
All
So
right.
I've learned, let's just see what happens, because
Let's see what happens.
we have to save some of these great companies. They can be great companies literally in a matter of weeks. We
Let's see
have
what
to save
happens.
them.
Let's see what
Yeah,
happens.
Mr. President, can
Let's
I go
see
back
what
to your
happens.
announcement at the top about the National Guard and then also the
go
the
ahead.
medical structures that are going to be built. Okay, so you had said that there would be 8 large medical structures that will be built in California with more than 2,000 beds. And then I think I heard you say there would be 4 small medical structures in the state of Washington with 250 beds. And could you say what cities and areas those are going to be in specifically?
So we are filling the governor's request, and so we send that resource to them. They'll put it to best use. They'll put it to where they will have the most effect. So we don't dictate exactly where it goes. Again, it's a request from the state to the federal government for a certain asset, and those assets are sent to the
Yeah, this is
governor can use it
frustrating.
as he or she sees fit.
And you're still considering, you just said that using the cruise ships as well. So
If we need them. I hope we don't need them. I hope you're going to have great luck on
Me too.
Tuesday morning. We sent a lot of the medicine. We don't have to go into it again, but we sent a lot of the medicine to Governor Cuomo. I believe they already
It's a good
have it.
answer, though.
And they have some very capable people. We spoke to Dr. Zucker, who is his primary representative on this. And we spoke to the governor himself. And I think he's excited about it like I'm excited about it. Now, will it work? I think it has a really good chance. I think it's worthwhile. Why should we be testing it in a test tube for a year and a half when we have thousands of people that are very sick? They're very, very sick. And we can use it on those people and maybe make them maybe save their lives. So, Governor Cuomo
He just wants
told
to
me
use
they'll be using
unproven
this, and they'll
medicine on
explain this
people, huh?
on Tuesday
Just
morning.
what do they have to
It's very
lose?
exciting.
They're
I
going,
think because,
you know. Oh
if
my
that
God.
happens, much of what we're talking about with ships and hospitals and all of the things that we're doing and all of these masks and everything
Ships,
that we're ordering,
hospitals,
that's a whole
ventilators,
different game
masks.
if that happens. And we'll see. There's been some tremendous signs. Again, you know, some doctors think it should go for years, and this has been something that's been around for many years. It's been phenomenal, strong, powerful drug for malaria. Might work on this based on evidence, based on very strong evidence. We're going to see, we're going to know on, you know, sometime after Tuesday. But you'll have to ask
Sometime
Cuomo. I think
after
they're gonna start the
Tuesday.
process. We've gotten them
After Tuesday.
I think they're going to start the process of.
That was a great answer. Like, we'll
through
know
mouth.
sometime after Tuesday.
And I think that starts on Tuesday morning.
I
He
like
said,
that.
and that'll be.
Uh-oh.
I mean, I tell you what,
Tuesday's a
I
big
don't want to
day.
get anybody overly excited, but I'm very excited by that, by the prospect of it. Then, in addition to that, they're working. NIH is working on vaccines and all. They're making great progress, but the vaccine does have to be tested for a long period of time because you can't give, thousands, millions of people a vaccine and it turns out to be dangerous. So that does have to be tested. But this one's been taken for a long time, so we know pretty much one result. Yeah, please.
Thank you, Mr. President. I wanted to ask about China and President Xi. When was the last time you had a conversation with
Well, I don't want
him?
to exactly say that, but I have spoken to President Xi about this, specifically about this. And look, he doesn't want this. This is not something that he wants. And it happened. It happened to China.
Oh my
And
God.
one thing they told me, I was told by our great Secretary of Agriculture, Sonny Perdue, that China's been buying a lot of our farm product. And I'm looking at different pricing, but China has, despite all of this, and it started,
China.
it's delayed it a little bit, obviously, but it started fairly recently. But China's buying, we made a new deal, as you know, with China, a very big trade deal, and China has been buying our agricultural product.
Masks. I mean, they've been a supplier of the United States of masks, of a lot of
Yes,
this equipment.
in fact, they're
Have you
sending
tried to
some
open those
masks.
back up?
They're sending masks to Italy. They are sending masks to Italy. We're in a very good process with masks.
Yeah, good process.
But I'm a little upset with China. I'll be honest with you, because as much as I like President Xi and as much as I respect the country and admire the country, I have great admiration for the country, what they've done.
Great
in a
respect
short
for
period of
China.
time. Of course, our previous presidents allowed that to happen.
Mhm.
You should say thank you very much to all of them.
Mm.
But
Thank you, Obama.
they should have
Thank
told
you,
us
Bush.
about this. And I did ask him whether or not we could send some people in. They didn't want that. Out of pride, I think really out of pride. They don't want us sending people into China to help them. China's a strong country. They have their scientists and they have their doctors.
They probably wanted to send
I
people
think,
in to
but I
figure
did
out how they
discuss
slowed the
that
virus
about
down.
Sending our people in, and
Why else would they send the people
they
in?
didn't really respond. We went again. They didn't respond. If they went in, they would have been able to give us a much earlier indication. But we had an early
See?
indication. That's why I closed out China. I mean, I felt it was my instinct, but that's why I closed out China at a very early time. Please.
Mr. President, are undocumented persons welcome at testing sites, and can they show up and be tested without fear of being reported to immigration officials for possible deportation?
It's really a fair question. I think I'll let. Would you like to answer that question, please?
Absolutely.
Please, Surgeon General.
We have symptoms can get tested, but as you heard earlier, we are
All right. I have to stop the stream. Fiona. Fiona. Did you fall asleep on me? Watching Trump go crazy.
No, I didn't fall asleep. I've been peeling myself off the ceiling.
Why? What was this? It's madness. We've been here for 2 hours though. I was like, what? This is madness. This is madness.
Yeah, all I'm seeing is I'm running behind the virus all the time. All the time. It's been like this from the get-go.
But now we know a couple of things though. Like
Yes.
the first thing now we know, they got what is it called? They got was it hospital beds? I'm coming about 1,000 in New York. They're thinking about using cruise ships as hospital facilities. So they are really ramping up hospital beds, which is a good thing. So
It is, but here's the problem. This needed to be put in place 2 to 3 weeks ago. Because when you're dealing with something as fast moving as this, you can't afford to be weeks behind it.
But now you're saying China won't let his people in. How would he know?
Well, you see, the people who would have gone in would have been the pandemic task force. The job of a pandemic task force wasn't to go in when there is a pandemic. Their job was to see an infection coming up that had the potential to be a pandemic and to go in there and stop it becoming a pandemic.
Mm.
They were done away with.
Yeah.
Now, if they'd still been in place, then they could have done it. On top of that, they used to cover 46 countries on this, and Trump decided to cut it back to only 10 countries that the US would get involved in.
Was China on that list?
China was on the list of countries that were removed.
No.
Right. And so that's why they couldn't get into China. They weren't one of the 10 countries still on the list.
Well, listen, it's, at this point in time, I don't want to blame anybody. I don't want to do anything. I do understand after the hurricane comes through, then we can decide whose, fault it is we had, but at this point in time, it's about getting hospital beds, stopping infection, and really trying to keep people safe out there. And it's a sad development, but it seems like they are preparing for the worst. You don't build, what as you said, 4,000 makeshift hospital beds, and have 2 Navy ships on the coast and are saying you're going to commandeer cruise ships, you're going to seize people's property unless you believe there's a serious problem. They believe this is a serious problem,
Yeah, it didn't need to get quite as bad as this. But can I bring up one thing?
Go ahead. We got 5 minutes.
It nearly killed me. And it was when whoever that guy was,
Mm-hmm.
I've no idea. It's the first time I've noticed him. When he said, currently there is a truck traveling to New York City with hand sanitizer. And I thought, a truck, one truck traveling to, it was just the way he said it. It was as if this was this huge thing. There's a truck going to New York with some freight. What? I had to let my husband hear that, but after I picked myself up off the floor.
He had a couple of laughers in there. One thing, I love how he just totally long-winded the answer about will you take government, will you take government benefits? He just totally that was the best non-answer I ever heard. That guy knows how not to answer a question. That guy knows how. And since he's president, you got to let him speak his mind. But listen, Fiona, let me get out of here. I got to run. I will definitely see you on Discord, and to everyone else, listen, thanks for watching. This is an interesting stream. I hope you learned something today. And as always, my name is Nate. If you like what you see, hit the buttons below. I cannot find how to end this stream. I just found it. Yo, guys, peace. I'm out.